The focus of this series is on yeast infections. Follow this video and learn more about yeast infections, their causes, and how to treat them. Are you ready? Great. Let's get started. Let's start with some basic information about yeast infections. This will give you a better foundation on understanding yeast infections overall. So what are yeast infections? Yeast infections are those infections that are caused by the fungus Candida albicans. These fungal infections affect women around the world regardless of socioeconomic status or race. Infections occur when the normal balance of flora in both the vagina and labia is disrupted. There is Candida albicans present in the mouth, vagina, and skin with no apparent symptoms in many women. In other words, they're asymptomatic. So what are some symptoms, you might ask? Many yeast infection sufferers report a moderate to severe itching present in the affected areas. Other symptoms may be abnormal discharge, cottage cheese-like, often reported. Inconsistency can be thick or thin in viscosity overall. Burning sensation in the labia vagina. Painful urination due to irritation from infection. Painful intercourse. Okay, now that I know that I have some kind of infection, what do I do? Well, the first step, as always, is to schedule an appointment with your doctor. What is so important about seeing your doctor for at least the first infection? I can hear you saying now. Well, the main reason that you should go to your doctor is that many other disorders mimic many of the symptoms that the yeast infection sufferer presents. It is that vital to differentiate between yeast infection and other infections. Can't emphasize that point enough. Once you've been to your doctor and he's confirmed that you do have a yeast infection, you must now turn your attention to the various treatments available today. And some of the treatments available are, we'll touch on those briefly, use of antifungals. Now, this is the most used and often familiar treatment to many women. Just look at all the commercials on TV for yeast infection treatments. You really can't miss them, can you? Here are some of the popular antifungals available. Miconazole. This is found in preparations such as suppositories, creams, and wipes. Chlorotrimazole. Again found in cream, suppository, and wipe forms. At one time, these medications were available only via prescription, but no longer. They are readily available over the counter in many drugstores and even grocery stores. Well, what about natural treatments for yeast infection? There are many treatments available, and we will examine those also briefly. Natural treatments for yeast infection include cranberry juice. Yes, it works. Yogurt. Eating yogurt can help, especially good for treating thrush, or oral thrush is the more proper term. This is yeast infection that's found in the mouth. Doctor will say eat yogurt for 3 or 5 or 7 days. It's going to be according to the doctor's preference, and surprisingly enough, it works. Gets rid of all the candida in your mouth, or the overabundance. A whole multitude of preparations are available on the internet today and at your pharmacy. A word of caution. It is extremely important that you check with your doctor before you use any natural over-the-counter treatments. Again, I can't emphasize this enough. There are many homeopathic or so-called natural compounds that really are, in fact, do act as medications and can interact with any kind of medication you're presently taking, and may even mask the symptoms of other serious disorders that you may not be aware of. So again, due diligence is in order.